Hey y'all. Oh, I'm excited. We over y'all auntie house over here on YouTube. This is the first time being on YouTube going live, so bear with me, y'all. Zoe is having a moment. She wants to be in the flick. And I can't wait to go all in. We're gonna have so much fun today. Hey y'all. Hey everybody. Happy New Year. Oh, I'm so my heart is so warm. Y'all are joining me here today. I hope y'all had a wonderful Christmas. A wonderful Christmas. I'm gonna tell y'all what I got. Um, I can't wait to go in on this one. So I'm gonna tell y'all what I got. Kind of tell y'all what I did a little bit. Didn't really do a whole lot, but and I'm gonna tell y'all what I'm just gonna tell y'all just so much stuff. I can't wait. We're gonna go in. We have a good time. Thank you on your video. The Sigma is so much worse than the condition. I told y'all, girl, and y'all didn't even drop no questions. Like, I don't know why y'all be so shy. Y'all dropped no questions. I'm finna get y'all together. Yes, so welcome to my live. This is my first time being on YouTube live. Hopefully it's not much different. I don't think it's gonna be much different. So yeah, can't wait to go all in, y'all. If you know me, you know I don't drink. This is Sprite with some maraschino cherries. I don't know. It's not like I'm holier than thou. I got something against it. Hey, girl. I don't know. Like, I can't do it anymore. It makes me feel sick. Like, I take a couple of sips and, honey, I'm ready to lay down. Like, not even sleepy, just feel bad. I don't know. So it's just not my thing. My thing is if it make me feel bad, girl, who's doing it? Not me. So, yeah. So, for all of y'all who are new, welcome. Um, Girl, how I am on Instagram and YouTube is how I am in person and how I am at my office. So, you know, what you get is what you get. And this is why I love it here. I'm so comfortable with y'all. Um, so, first of all, as far as the holidays go, well, before we even go as far as that's concerned, and I hope enough of y'all are here. You know, y'all are not flooding me like on Instagram, but it's okay. The rules here is just that everybody's free to have their opinion. You're free to disagree with each other. You're free to disagree with me. It's all good. Let's just be respectful though, y'all. Like, we catch it from so many different directions. We really don't need to catch it from each other. So let's just be mindful and be respectful, and everybody's knowledge level is different. So what you might be like, that's a dumbass question. Somebody legitimately may not know. Okay. So, you know, if I see it and I can answer it, I'm gonna answer it. Let's just everybody keep it a book and act like your young niece is up in here and she just trying to get some knowledge. All right. So, um, between what's the oh, I think you got a typo because it says what's the love between a C-section than a natural such and such and such. So retype that in because I don't understand the question. All right, y'all. So here's the jam. So first of all, I hope everybody is having a happy, healthy, and safe holiday so far. Right. So for Christmas, I really didn't want a lot this year. I was in a space. I felt like this year brought a lot of revelation to my life. Like, excuse me, that Sprite got me all. So I don't know, like friends were revealed and lack of friends were revealed. You know, what I want for myself in business, what I want for myself personally. Like so many things were revealed this year, right? So Christmas is my jam. And I go all in on Christmas because I'm an only child. And by choice, I did not have children. So, and I don't really do my extended family. So my friends, my good friends are like, we rock out. But Christmas this year, and I'm usually like, honey, my tree is something that looks like something in Neiman Marcus, okay? The decorations in my house, like everything, I go all in, all right? It's a winter wonderland around here. But this year I was kind of like, I don't know. But it was just a lot of revelation and a lot of things that, you know, were important to me. I don't know, like it was a good thing. I got everything that I wanted, but I really didn't want anything. And so I have so much new stuff coming y'all's way. Like it feels so good to be able to extend so much stuff to y'all. And baby, when y'all see what's coming this year, 2025, what? But no, I'm immensely grateful. I'm looking forward to the new year, getting my house all cleaned and straightened up. I just go over it with the fine tooth comb, writing out my goals, my first quarter goals, as well as the goals for the year for myself, my businesses, my finances, spiritually, physically, everything. Like just getting everything written out and getting that squared away. So this has been a really good week. I've been out of the office and just I needed the space and the time for me. Yeah, you know, they say your cup runneth over and you're supposed to kind of give others what's in your cup. Well, excuse me, you're supposed to give others what runneth over, not what's in your cup. So I needed a second to fill my cup so that when I do go back, I can have a little extra to give y'all because it runneth over. Right? Okay, so let's get into it, y'all. So this year coming, I'm always wanting to educate. You know that, right, guys? And always wanting to educate. And one of my biggest things is labor and delivery. And so for me, 7,000 deliveries in, zero fatalities. And I pop my collar about that, but to God be the glory. To God be the glory. To me, be the anal one, up all night watching strips, up on nurses' asses, not letting them do some nonsense. But to God be all the glory. But there's a formula for it. There is a formula. There's a thing you do. And I think that the younger doctors are too arrogant to listen. And you know, it's just not getting translated through. No disrespect to anybody, but I'm keeping it 100. So this year, I am putting out a manual. And the manual, it takes you through your entire pregnancy. And it's especially for Black women, but it's for any woman. Okay? But I'm taking you through your entire pregnancy. I'm telling you what to ask your doctors, what tests you should have, what trimester, what you should be eating, what you should not be eating, what you should be doing, what you should not be doing, things to avoid, vaccinations, foods to avoid, medications to avoid, everything. I'm telling you guys everything. And then once we get to labor and delivery, Zoe about to nut up on us, y'all. Once we get to labor and delivery, I'm telling you what to do, how to behave, because I hate to say it, but there is a behavior. You say, oh, you know, I should be able to do what I want to do. No, you can't. I'm sorry. You want to stay safe, you just can't. And yes, a stigma does come when your baby daddy comes and smells like weed and is smelling up the whole, and everybody's eyes are burning. Yes, you do get treated a certain way because of that. You shouldn't, but you do. I'm going to keep it 100. So the entire manual tells you everything from start to finish. It tells you tidbits like that, fetal kit counts, how do you know if your baby is okay? Like when to be like, something ain't right. And what to concretely be able to dig your feet into and be able to say to them on labor and delivery, what to do once you get there if something goes to the left. And finally, I took a little bit of time to put this out because what the deal was that I wanted to have, because finally when all else fails you can call legal counsel to your bedside, and I wanted to make sure that I kind of collaborated with the law firm that I kind of trusted, in the spirit of they would give you what you paid for. You ready to dip? You done with me? That they would give you what you paid for, and wouldn't be in the midst of anything janky. And so with that being said, it took me a little bit of time. But this will be coming out in the first quarter, either end of January, early February, and you guys will be able to purchase that manual. There'll be a little section in the back for notes, because you will need to take some notes with stuff. There'll be a section in the back for notes so you can refer to it. It'll be like your handbook. Okay, and we're also going to do one for women who may not be on labor and delivery, but you're going into the hospital. Not even just women, but you're going into the hospital. You're going to have surgery. What do you do? What are the do's and don'ts? What are the wills and won'ts to keep you as safe as possible? I cannot reach each and every one of y'all, but at the end of the day, for you to go back, what she said about this, and what, you ain't got to go looking for videos. You don't have to go anything. It'll also, yes, it will also cover postpartum. Now, post-delivery, anything postpartum, you're susceptible to anything postpartum for 6 weeks after delivery. Right, guys? So I don't care what it is. People kill me. This is the funny thing. And it'd be so cute because it makes sense. It legitimately makes sense, but this is not how it goes. So a lot of times people are like, I had post-eclampsia. That's not a thing, y'all. It's preeclampsia or eclampsia. And eclampsia is all the stuff with preeclampsia plus seizure. And preeclampsia means before the seizure, but there's no post-eclampsia, but you can have postpartum preeclampsia, meaning some people literally don't. Okay, you ready to go? Give me a second, y'all. Some people literally and legitimately don't suffer with preeclampsia, or it's at least not diagnosed until after delivery. And that's a thing too. So anything that can happen during the pregnancy and during the delivery can happen up to 6 weeks postpartum. So when people get out the hospital and they like, psh, and don't, no. Please keep paying attention. Please keep taking these meds. Please keep a watch on your blood pressure. Please make sure you're not short of breath. Like all the things. So yes, it will take you up until 6 weeks postpartum when you become a GYN patient again. So once you become pregnant, you're an OB patient until 6 weeks postpartum. You get that 6-week exam. Oftentimes it's blood work, blood pressure check, make sure everything has normalized, make sure your vagina's okay, your C-section incision, all the stuff. And then after that, and everything's good and it's been 6 weeks, then you're a GYN patient again. Okay? So that will be coming out in late January. We tried to get it out before the turn of the year, but I just wanted to make sure it was perfect for you guys. And I had to put in a couple of additions. And then around the same time will be the one for surgery, going into the hospital and how to stay safe in surgery. Further along, I'm going to try and do one as far as the emergency room is concerned as well. But we will see. So it is not going to be very expensive. Again, it's going to be like less than $50. This will be something you can refer to for your entire pregnancy. This will be a gift that you could literally give somebody. So yeah, I'm very proud of it, very happy about it, very proud of it. And I hope you guys enjoy it and are able to really use it and find the value and virtue in it. Because it took me some time to want to do it, because, people will grab stuff here, grab a little piece of this, grab a little piece of this, and bastardize it and make it negative and do whatever they can do as far as to make money off of it or to shoot it down. And I just didn't want to be in that space. But so many people need the information. So many things I see, people like, wow, I wish I would have known that 2 months ago. Wow, I wish I would have known that 3 months ago. And so there's that. All right, so that's one of the things that we're doing. Okay, because somebody just asked me something about having a C-section first and then preparing for a natural birth, second pregnancy. Okay, that's called a VBAC, or vaginal birth after C-section. Excuse me, guys. I got to deal with Zoe. I got a 15-year-old diabetic dog, and she requires a lot of attention. So give me a second. Let me put her in her little apartment. Okay. Somebody asked me about having a C-section first and then a natural birth as a second pregnancy. Now, I'm going to tell you exactly how I used to counsel my patients. All right. And I don't ask. So I never give opinions when it comes to medicine, because how I feel and what I think may not be conducive to your life. I educate you, and then I allow you to make the proper decision, right? And I educate you fairly. So, vaginal birth after C-section, here it is. Anytime you cut the uterus. Now, there are some C-sections that you have called a classical C-section, where the incision, not on your stomach, not on your skin. I'm not talking about the incision on your skin. I'm actually talking about the incision in your womb, where the incision on your womb goes up and down vertical like this. You can never have a vaginal delivery. Do not try it. If somebody's trying to try, oh no, we're doing it now. Don't do it. That's a red flag. Get the hell up out of there. Don't do it. Okay? Now, most C-sections, unless it was like a very preterm C-section or some type of extreme emergency, but most C-sections are going to be horizontal C-sections. Okay, or just traditional C-section, just horizontal, which means that you can actually labor after you have that type of a C-section. But I always ask my patients, because you can do something should you do something. Now, a lot of people are always like, I want a natural birth, I want a natural birth. Okay, and what I used to always tell my patients is, I do not promise you a vaginal delivery. I'm going to do my best to get you a safe delivery and a safe baby and get your tail home. I don't determine how that happens. None of us determine the mode of delivery unless that nothing that we can control, right? So once your uterus has been cut anywhere, it's weak in that place that has been cut. If you can imagine, that makes sense, right? If I cut it, yeah, I'm going to sew it up, but that place that was cut is never going to be as perfect as it was before it was cut. Does that make sense? So, kind of, if you can think about when you're in labor, your uterus kind of does this. With your contractions, it does this. It kind of like wrenches the baby down. And it starts from the top and it goes down and it kind of like pushes the baby down. That's the purpose of the contraction. So in that area where the uterus was cut, it's obviously weaker. And so what we worry about is the possibility, and it doesn't always happen, but what we worry about is the possibility of that area opening up. Now, if that area opens up, it's a wrap. It's an emergency, okay? And when I say an emergency, we have about 2 minutes to get in, meaning to convert from a vaginal delivery to a C-section, get in, get that kid out, and get that kid over to the pediatric team before we have oxygen compromise, okay? And oxygen compromise could mean a lot of different things, and none of them are good. So, with that being said, I would counsel my patients and say, after you have a C-section, you can absolutely do a vaginal birth. And we call, again, vaginal birth after C-section. The risk of a complication is so extremely low. The risk of a complication is only 1%. 1%. But if your kid is in that 1%, you're not going home with the baby you think you're going home with. If you do go home with the baby, and it's a strong if you do go home with the baby, that baby's going to be compromised forever. Does that make sense? So, yes, ma'am. So, is it something that you can do? Absolutely. Do people do it all the time without any complications? Absolutely. But if you are one that has a complication, that complication is detrimental. Do with that what you will. Now, let's be very clear again. You say, well, what are the risks of a C-section after a C-section? So I'm at 2 C-sections now. Once you've reached past 2 C-sections, a vaginal delivery is never, it should never be on the menu again. So once you get to 2 C-sections, we can't have any more vaginal deliveries, right? And obviously, whenever you have surgery, the more surgery you have, the more risk of scar tissue. But that is a loaded thing. Why? I've done C-sections on people who have had 1 prior C-section. I'm like, God, dog. I'm in there sweating, trying not to get into the bladder, doing this. I got to make my incision off to the side. Girl. But I've done C-sections on people who have had 6. And I'm like, was she lying? Did she really have C-sections? Because it was clean as a whistle in there. So everybody's different. Just like some people keloid, some people don't. Some people heal well, some people don't. So this is why I say you have to do what's best for your life. If you feel like, nah, I'm going to want 6 kids, and your first was a cesarean section, but you feel like you want to attempt a natural delivery, absolutely. The only thing that I would say is have an open line of communication with your provider. Before something really, really goes to the left, oftentimes you can see something. Hopefully it's a provider that's really trained well in doing vaginal birth after C-sections, because there are certain things that you can look for and that you can see that, will prompt you that something is not right. Like, something is about to go to the left. And hopefully that provider will pick it up, see it, and run you to that operating room. And you also have to have in your mind, and I would negotiate with my patients and say, listen, if this is something you want to do, I'm on it. And I'm going to be on it. Don't worry about that. But when I say ball game over because something ain't right, you have to be willing to accept that. Because you ain't fitting to put me on the line and risk me for this. And I'm like, nope, this is not safe. We need to stop. And you like, no, I think we can do it, because I ain't signing up for that. But if this is something you want to try, you come in labor, you're contracting on your own. This baby looks great. We go from 5 centimeters to 8 centimeters to 10 centimeters, ready to push. I'm with you, sis. But if that's not the situation, we got to try all these extra drugs. We got to do this to get you in labor. These things are a risk for making your uterus rupture. The baby don't look good on the monitor. Girl, who? Who? So with that being said, I'm always very cautious to, because I don't ever want anybody to think that that I am for one side or the other. I'm not. Like I said, it's what decision is best for you and your partner and your family. Have I seen both things? Absolutely. I've seen a bunch of successful vaginal birth after C-sections. Absolutely. Have I seen the inverse? Absolutely. And her bedroom was right next to the operating room. And by the time we got in the operating room, this baby was floating. Thank God it wasn't me. Let me just say that. But this baby was floating in the belly, and there was nothing we could do. There was nothing we could do, and she went home without a baby. So the reality of the situation is ugly things happen. So you educate and you decide what it is you want to do. And I'm still going to do my absolute damnedest to make sure that it doesn't happen. But that's it. That's that. People try to glorify it. Oh, you can always have a vaginal birth after. Yeah, people try to glorify it. And then the craziest damn people, and I know y'all out here, but I'm saying it, the craziest damn people are the people who have a C-section, and then do a home delivery for vaginal birth. I know you out here lying. I know you, girl. Ooh, my heart just literally, I have palpitations just thinking about it. Please don't. Like, I tell people all the time, be careful with the word natural, right? We jump on natural, we jump on organic, we jump on vegan, we jump on holistic, we jump on these terms, right? But if you stop and think about it, and this is in no judgment, we listen, we don't judge. Cocaine is natural and vegan and soy-free and holistic, all that. It's just not a great idea, and it's not great for you. So understand what you're signing up for, what you're signing on to. And those are, yes, the baby did die. I stumbled across, okay. So what's the total number of C-sections you can have? Again, that is up to you. Depending on now, like let's say I have a patient and I get in the belly and I look and I'm like, so I'm gonna tell you about a C-section I did one time that scared the absolute, two of them, two, that scared the absolute bejesus up out of me. It was when I first moved to Atlanta, and I was working for a crazy practice. And crazy meaning, I loved the patients. They were absolutely wonderful. They were a breath of fresh air. But baby, everything was coming out of everywhere. You didn't know. It was just craziness. And I was, coming from a little bougie place, honey, and Atlanta threw me in the deep end. And I was like, all right, I'm built for this. Let's do it. So they call me and say, Doc, this patient is having some abdominal pain. She's 36 weeks. She had a previous C-section, and it was a placental abruption, which is a whole nother situation. But she's having pain, and it was around the same time that she had a placental eruption. I was like, I'm en route. Get the operating room ready, period. And I'll deal with the details when I get there. So I get there, I talk to the lady, blah, blah, blah. They had already drawn the blood. The operating room was ready. They had the consent forms ready for me and everything. I said, okay, blah, blah, blah. And I talked to the lady. She's like, I don't care. Let's just go for section. I'm in pain. I'm scared. I said, all right. They were taking forever to get the room together. I said, what are we doing? What? And if you know me, I will come at your ass on labor and delivery. I'm like, what are we doing? What's the problem? Like, oh, well, one room, I don't care. Okay, this is an emergency. So either I'm going to call a code blue or we're going to go to the operating room right now. They were like, okay, doc. Yeah, okay, doc. So gets to the operating room, y'all. So if you can think about most of your organs, right? Most of your organs have like something like a layer of like, it's not actual, we call it serosa. But if you actually think about it, it's like a thin piece of saran wrap over like each organ, right? For very protective reasons, for stuff, right? And what happened was this lady, her uterus had opened up. Remember I told y'all about the opening up of the uterus? Her uterus had opened up. The only thing that was keeping this kid alive was that layer of saran wrap. And when I opened her belly and I opened all the layers and I got in, blood was squirting out of that little, like a little hole in that little saran wrap layer, y'all. This lady probably had about 30 seconds to a minute before this kid died. I ain't never been so scared in my entire damn life. The scrub tech was like, yo, real loud. She's like, what? What? Because the patient's awake. I'm like, I mean, my mouth just dropped. I snatched that kid out of there. Peas grabbed that kid. Baby, when I tell you a near miss. So I get the kid out. I'm doing this. I turn around back to the table. Y'all, this lady's entire uterus split down the middle like this. Like it split wide open on Mary, Jesus, and Joseph. The damn scrub tech down there start crying. She was new to me, but you know, I said, she said, what we gonna do? And this lady, she had bad luck with a baby before. This baby we got out by the grace of God. I said, we gonna do what we know how to do. We gonna sew. Baby, I sewed that thing back together. I saved that lady from having to have a hysterectomy, but I went in that room the next morning. I said, let me explain something. And I'm going to put this in my notes. I'm going to document this. I'm going to document this everywhere I can document this. You are never to have another baby. Ever. I saved your uterus, sis, but you're never to have another baby. And that was only C-section number 2. But when I was in training, I had a lady, and I was in training. Thank God I was not the head doctor. I was in training. I was like, okay. C-section number 9. Number 9. This lady probably was about 5 feet, 99 pounds at the most. C-section number 9. Baby, we had vascular surgery in there. We had general surgery in there. We had 2 anesthesia teams in there. We had 6 bags of blood waiting. We had 3 residents, 2 attending physicians. Baby, we was ready. You hear me? We were ready. C-section number 9. We had the main OR staff up in there ready to convert to a hyst. Ready. This lady's belly was clean as a damn whistle. I never seen anything like it. I'm like, I know you damn lying. The attendings were looking at us. The attendings are head doctors. The head doctors were looking at us like, who the hell read the chart wrong? Who the hell read 9 C-sections? Because it's going to be your ass when we get out this operating room, because we done called every surgeon in this damn building in this operating room, and we look like damn fools. But it was true. She had 9 previous C-sections and her belly looked great. So I don't know that it is a specific number that you can have. I think that it is based on what anybody sees when they're in there. So again, another C-section I'd done. This was probably this was probably in about 2000. And it made it difficult because this patient was like 350, 400 pounds. And yes, the more you weigh, the more difficult it is when you have a C-section. Difficult for the surgeon. And I got in. I had done her first C-section, so I know me. When I do a C-section, I don't close in 1 layer. I close in 2 layers. I close your uterus in 2 layers, okay? I don't play by it. We ain't finna bleed into the belly. We ain't doing none of that. I closed that thing in 2 layers. When I got in there, her, the saran wrap I'm talking about, her saran wrap was just, it was what it was, but she had a hole like this on the front of the uterus, even after me closing 2 layers, but her water wasn't broken. So again, that's what saved that kid. Baby, let me tell you what. Y'all be playing around with this, oh, vaginal birth, C-section. Baby, the level of things that can go wrong, you just don't even understand. So I always say err on the side of caution, but everybody, you have to do what makes you happy. You have to do what makes, what makes you happy. And, so there's that. There is that. So I can't believe, first of all, I can't believe that y'all didn't put a bunch of questions in here, because y'all always be like, okay, I got questions, and ain't nobody put no questions in here. I cannot believe that. So tell me, y'all, what do y'all want me to cover? Like, what's up? What's tea? What's tea? What y'all got on y'all minds? I'm willing. It's the last live of 2024. I think I'll be toggling back and forth with the lives between, excuse me, Instagram and YouTube. Until I get a little bit more used to YouTube, I'll be doing them both. On Instagram, one of my patients said, "Would you be up for delivering more babies in the future?" No, 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 no. I don't deliver anymore. Yes, ma'am. I don't deliver anymore. And the reason that I don't deliver anymore is because unapologetically, I'm very strict. I'm a very strict obstetrician. I'm very strict with my patients. I'm like, you should be only gaining 4 pounds a month, 4.5 pounds a month. Don't come in here 9 pounds up and think it's funny, because I will dismiss you from the practice, because not because you gained 9 pounds, but you have to take your health seriously. Like, you should be eating a particular thing, drinking water, walking, staying active, dealing with your, yes, you can wash your grandbabies because clothes are clean and cute. It's all natural. And I know I just said that natural word, but I make it. So yes, it is all natural. So I used to did not play. Um, and I was the same way on labor and delivery. Like, you're not going to do what you want to do. You're going to keep me posted on my patient. I'm going to call 2 o'clock in the morning if my spidey senses. Zoe, 2 o'clock in the morning, if my spidey senses get the tingling, I'm walking up on labor and delivery. And it got to a point where there were so many inappropriate things happening. And I would check those things. And I'm not going to check you in front of a bunch of people. I'm not going to be ghetto with it. I'll pull you into a private area. But it got into a space of, a lot of nurses were like, well, I know she's going to write me up. And I'm not the type to write you up. I don't give a damn about writing you up. I'm going to check you where you stand, and hopefully you'll correct yourself. Me writing you up don't do nothing for me. But they would then write me up. Like, what did I do? Like, you were wrong. And it just got to a point where I couldn't correct anybody for anything. You can't say anything, or you're being abusive, or you can't. And I couldn't deal like that, because you didn't sign up for the nurse to be responsible for your kid. You signed up for me to be responsible for your kid. But if the nurse doesn't know enough, or is not paying attention enough to even call me to say, hey, my mother is in trouble, my baby is in trouble, then how would I know? But the responsibility is mine, and you're trusting me to care for and, ensure a safe transit for your baby into the world. And it just was too many variables I could not control. And when I tried to, they made it seem like I was like being an asshole, and being mean to people. And I'm not being mean to you, but you're not going to be braiding hair in the lounge while my patient is 8 centimeters and waiting for anesthesia. Like, we're not going to do that, because I'm going to check you hard. And if that was not something I was, if it was going to be a problem, no, I can't do that. I can't do that. Oh, thank you, girl. Thanks for loving Clean and Cute. Oh, and another thing, if y'all use Clean and Cute, can y'all please send us like a 30-second testimonial? Like, I love my Clean and Cute, because we will put you on our website, and you will be one of the people who get random sale codes. Like, we have codes that we send out. I tell my team, and I'll call them one day randomly when the spirit hit me, like, send out like 30 codes. Well, you send us a video, let us know that you're a frequent user, boom, code is yours on the regular. So it's just different things we do, different promos. I'm coming out with a couple of new products. I will probably send to my regular users, or people who we know love our product. I will be sending those things. When you order, you'll find extra stuff in your box. So don't be private. Don't be in the comments. Don't be hidden loving us. Let us know, okay? Send those videos to our DMs or our email that's attached to Clean and Cute, so we can know and we can bring you on as a baddie. A lot of times, even I pay attention to where these labels go to. I'm very hands-on with Clean and Cute. I pay attention to where these labels go to determine where am I going to do a meet and greet. Because 2025, I'm on the road. I will be in y'all city. 2025, I will be like Calvin, that boy at the grocery store. Oh, I'm going to be on y'all at the underwear section at Target with little bags of Clean and Cute minis to give y'all. So at the end of the day, don't be hiding. And when you see me out, please speak. Like, don't be like, don't do that. Just be like, hey, what's up, doc? And I'll be like, hey, what's going on, girl? And we can have a whole conversation, okay? So that's a biggie too. So do not hide, okay? Let me see. I want to make sure I don't miss no. Where do you see the biggest reason impact morbidity and mortality for Black women? Okay. Yes, let's talk about that. No, can my 5-year-old granddaughter use non-toxic bath bombs? Yes, so I'm not as strict. Before a female has her period, before her vagina is estrogenized, all the bubble bath and stuff, child, she can do it, but try and make it as natural as possible because some of this stuff is literally toxic. Y'all don't understand. Like, it is literally toxic. It is going into your skin and long-term causing cancers, and it's not that long. So if you're gonna do, like, bubbles or whatever, make sure what's in it. Make sure these labels are accurate. Oh, it's all natural. What does that mean? Because a lot of people are like, oh, it's all natural, and they're ordering it in bulk from Chinese websites and then just putting their own label on it. So you guys have to be very, very careful. But when it comes to like bubble bath and Mr. Bubble, y'all remember we used to do that when we were young, but it's gonna be before the vagina is estrogenized, so before puberty. Okay. If those are some things you want to consider. Even if it's a special request, girl, no, I special request. I love you, but I can't do it. Deliver who, child? Not me, honey. I'll be up in there with Vaseline on my face, fighting some nurse, and I ain't the one. Okay. Had to step out for a second, but can you discuss prep in African American women? Okay, y'all. So there are two things that we're about to jump all up on. Now, the first one, because I saw her question first, she was asking about what's contributing to the morbidity and mortality of Black women. And then somebody asked about prep and Black women, and I'm so excited about both. Those are my jams, okay? Now, I know that I'm going to offend somebody, but it is what it is. I'm being honest. I'm not trying to be offensive. This is my reality from the experience that I've had. I am 24 years in being an obstetrician. It hasn't been, no, it hasn't been more than 20, but it's 24 years in being an obstetrician. This girl started this journey in 2001, 2, whatever, after the millennium. But here's the deal. After a certain, that's why I say if a doctor ain't 45, they're going to kill you. There was a time when, you all right, Zoe? Just so needy. There was a time when, around 20, anyway, early in the 2000s, we used to work our asses off, like in medicine, which is totally different than now. We used to work our asses off. And what did that mean? That meant, let's say you were on call. Call started 7 p.m. Friday night. You worked 7 p.m. Friday night. You worked all day Saturday night, all day Sunday until 7 p.m. Sunday evening, right? So it's 7 p.m. Friday till 7 p.m. Sunday. That was weekend call for us. And plus, you might have went home for a day, to refresh or whatever, but you were still coming back to work on Monday. And then you were still going to do call 1 or 2 days. You were still going to do call 1 or 2 days that week, right? So it wasn't, we worked. So there was a situation where there was a Caucasian fella who had worked that weekend, who had worked a weekend, and it was holiday week. So instead of going to the call room or going home, going to sleep for a while, because look at how much he had worked, and then getting on the road to go home for the holiday, he wanted to be efficient. I guess he wanted to beat the rush. I don't know what the situation was. I don't know that young man, but he ended up having a crash. He banged out and he died, hit a tree and he died. His mother was livid. When we lose somebody, we're hurt, we're angry, we're a bunch of different things. And low key, we need somebody to blame. We just do. And his mother blamed the AMA, the American Medical Association. It was like, these hours that you're having these people work is unconscionable, blah, blah, blah. What, Zoe? What? Stop whining. It's unconscionable. It's this. It's the third thing, blah, blah, blah. And so they backed it up and said, okay, residents can only work up to 80 hours a week. Now, mind you, we probably up to about 130, 140 hours. We're not even counting the hours. We stop working when the work is done. So they switched that all up and it became 80-hour work week. So literally I'd be training residents and they'd be like, oh, Dr. Rogers, I have to scrub out. You're in the middle of a surgery. What you mean you have to scrub out? Oh, I have to scrub out. I've completed my 80 hours for the week. What? So it was a situation like, and I was like, okay, because again, I can't question nothing because I'm being abusive if I ask questions. So I was like, okay, so no problem. Go ahead and scrub out, do what you need to do. But just out of curiosity, what are you about to do for the rest of the day? I'm going to go to Starbucks and get a coffee and read about the surgery. So you're in the surgery with your hands in somebody's belly, and you're going to scrub out, go have coffee, and read about it versus getting the actual. Have a good day. Be blessed. So that training, who knows if I would have ran into a bleeder or whatever the case may have been, and then you would have been in there helping me fix an emergency situation. So therefore, the next time, or if you ever ran into an emergency situation, you would know how to fix it. That's training that you missed out on. That's training that you missed out on. So a lot of that has to do with it. One, we have, and it's a sense of entitlement because, I had a resident one time who was like, well, the paperwork says she's been pregnant this, that, and the third times, but I asked her and, she lied about her. Well, hold on. Because her whole family is in the room. Maybe her mother or maybe her husband don't know about that abortion she had. Don't call her a liar. You don't know her situation. So you want to call her a liar, but when I check you, then I'm being abusive. It was too much. It's too much. So this is what you have happening, a sense of entitlement. Don't do me that. Don't talk to me like that. I'm not doing that. Don't ask me to do that. This is where the learning is. This is where the learning is. So too arrogant and too entitled. I'm a doctor. I've forgotten more shit than you need to learn. You hear what I'm saying? But it's a sense of entitlement. It's a sense of poor training. The grind is not there. And then you have a sense of, and again, like I said, I'm going to offend some people, but it is what it is. Nurses are running medicine. A lot of CEOs are nurses. A lot of this is da, 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 da. Now, I love my nurses. Let me be very clear with you. Could I do your job? Nope. Guess why? Because I'm not trained for it. The nursing math, baby, blows me. I've had multiple calculus classes. I was a chemistry major, but the nursing math, it blows me. I can't come in the room and boop, 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 boop on all those machines. I don't even want to because that's not my lane. That's your lane. That is what you were trained to do. That's what you're good at. And because of big medicine, big corporate medicine, and medicine up until the Reagan era, was it Reagan? Yeah, medicine up until the Reagan era was nonprofit. Well, it's very much for profit. And so they don't care that the people who are doing these jobs are not the best people for, and not to say that you don't have good nurses. That's not what I'm saying. What I'm saying is, as a doctor, you don't necessarily know. As a nurse, you don't know what I need on the labor and delivery floor or any other floor. You don't know what I need. You don't know where just like, I think it's very insulting when the administration comes in. Oh, our nurses are working so hard and they want to buy y'all pizza. Pizza don't do that. Get me some more nurses so I ain't got to work 30 hours in 2 days. So administration doesn't understand what you need. But what y'all don't understand is y'all don't understand what we need. And so then it becomes, the nurses seem to still be angry at those ignorant ass doctors from the 1980s who talked to them bad and was nasty to them and made advances at them and treated them like helpers instead of the professionals that they are. And they carry that along. So it becomes this dichotomy of us versus them. And so when there's an issue with nursing on the floor, like remember I said, I'm like, why is my patient not? And I'm coming and the patient is, she's 8 centimeters, ready to, she in here braiding somebody's hair. What is happening? But when I say something about it, then I'm abusive. I got to sit in front of this person. I got to talk to this person. No. So you have a perfect storm, and we're at fault with this too. And then I'm going to tell you why. You have a perfect storm of people who are really not best suited to deal with things, and then people who are poorly trained. And between a nurse who might not know what she's seeing, because a lot of people trained during COVID, that was remote training. They had never put an IV in. They had never put a Foley catheter in. They had never done these things. Back in the day, in order to be a labor and delivery nurse, you had to work med surg for 3 to 5 years. You had to be a nurse for some years. You couldn't just come out and go to labor and delivery. No, that was considered, labor and delivery is technically considered critical care. So you could not just be a new nurse and go and do that. Now you can. So I think with a lot of the training that's not there, and a lot of the medical training. So by the time you get a nurse who finally sees, who finally knows what she's seeing, and then by the time they get to the doctor and the doctor comes in who may not be well trained at, dealing with different things, it's a perfect storm. And then there's no sense of accountability. Now, also, when it comes to us, I want to be very clear that traditionally, Black women have a higher BMI than other cultures. We just do. We're curvaceous, call it this, call it that, call it what you want. But at the end of the day, we have gotten so out of control with this damn obesity. And obesity is a disease. It is not something vanity. It's not about the way you look, the way you look in your clothes, how you look when you go to Telem. No. Obesity is a disease. I suffer with the disease. Now understand, I do a lot of work. My mama's side of the family is about 5 feet, 100 pounds until they get old, then they get big. My dad's side of the family is about 6 feet, 300 pounds, women included. So I am low key, like right in the middle at 50. Yeah, yes, she's 50. You see, I'm moisturized, hydrated, all this because Black does crack. But anyway, at 50, if I was not on my big one, paying attention to what I ate, making sure I took certain things, making sure I did certain things, the girl would probably have a BMI of about 47, 48. The girl would probably be about a 26, 28. Okay, I'm because she's big boned. You say that that's not a thing, but remember we used to say, "Oh, she big boned." That's not a thing. Um, so if I did not really make myself, I would have very big back behavior. Okay. And so we have to be very mindful of that because obesity worsens things so much more than you can ever understand. Poor nutrition, not even obesity, poor nutrition. And you know how I used to know when people were poorly nourished, and then you know how I used to know when my patients weren't doing what I would tell them to do. When you go for a C-section and we throw a stitch in that uterus, and I go to pull that stitch through, and it pulls right through. Rather than the uterus holding that stitch, it pulls through. Poor tissue texture, poor nutrition. So all of those things, our vitamin D levels are low. When your vitamin D levels are low, you're susceptible to depression, obesity, stroke, heart attack, all cancers. Like if there's anything that you can think of, low vitamin D levels make it worse. And 82% of African Americans are deficient in vitamin D. We just are, y'all. So, and our skin is melanated. We filter out just like we filter out some of the bad stuff, we filter out some of the good stuff too. So making sure you're on your vitamins, you're drinking water, you're just being health. Like you have to pay attention to your health. No disrespect and no shade. And I don't know if anybody, whoever else is on here, Black women, can we normalize not being so fixated on what's on our body and be very much fixated with what goes in our body? Like, so between us not being our best self, between the people who you run into not being very skilled and not really caring. And then let me just let you know something. As a Black woman, you're very low equity in the hospital. I hate to say it. They give you a pass when you get these degrees and they let you sit in the room while they say certain stuff because they assume that you're not still part of the establishment, but I'm is. Now, because you ain't gonna do nothing but hire one of these poorly spoken attorneys and somebody gonna find a reason to march or protest for a week and then it's gonna go away. And then they're gonna cut a side deal with your attorney and they're gonna get a check and you're going to be asked out and you might get $5,000 or $7,000 and then part of that is going to be non-disclosure, so nobody's ever going to be able to read the details of the case or any of those things, and then it's just going to go away. So to be perfectly honest, if I'm going to keep it 100, which is why I do a lot of what I do, there ain't nobody out here coming to save you. You have to save yourself. You have to do the best thing for yourself. Stop being at all these fast food chains and, all this crab stuff and all this and eating crazy and drinking crazy and hookah and Hennessy and all this foolishness y'all are doing, and then having poor outcomes, and then it's everybody else's fault. No, like we got to start, yes, I'm my sister's keeper. That's why I'm saying what I'm saying. But the reality of the situation is, you got to take responsibility for yourself. And we have to start finding the benefit and not flying a turkey to get our teeth done. How about registering at Orange Theory and just take a class to keep our heart healthy? How about going to the dermatologist and getting a treatment, an esthetician treatment, something like that to keep our skin healthy, and drinking some water instead of going to Sephora and spending $300 on makeup? Now, granted, I'm a Sephora girly before this whole election thing, but I'm a makeup girly to some degree. I'm not good at my makeup, but I like the way that it looks. I try to play around in it a little bit, but not to cover my skin, just as an additive. So let's try and put more into ourselves, so then that'll come out in a lot of different ways. And so if you want the answer, that's the answer. Poor skill set, corporate medicine wanting to pay. And again, not to say that our nurses are not skilled, but you generally pay for degree level. So wanting to pay a nurse $175,000 for something you're going to pay a doctor $300,000 for. They don't give a damn about these outcomes. They just care what their bottom line looks like. And again, not to get on my soapbox, this is the last thing I'm going to say about this, but again, y'all were so fixated with the presidential election, and so was I. But your local elections are very much more important. Why? Because that is what affects what's happening in your home. That's what affects what happens in your home. And like I say, until we start to attach these outcomes to funding, nothing's going to change, right? So until city council in your city says, we're not giving this hospital any money, because every time we turn around, a black woman is dying in this hospital. Y'all ain't getting no money from our county, from our city. What are y'all doing that these black women in this city are going down? Until y'all can show us, until y'all can fix it, until y'all can improve on it, y'all are not getting a dime. So until the outcomes start to be attached to the funding, you're not going to see any difference, because that's what it's all about, the bottom line. I hate to say it. I hate it for you. I hate to say it. So there's that. Now, somebody had asked about PrEP and African American women. Y'all know that is my jam, and I have so much to say about it. So you have PrEP and you have PEP. For anybody who does not know what PrEP is pre-exposure prophylaxis, and PEP is post-exposure prophylaxis. And if you did not know, these are medications that you can take to prevent you from getting HIV. Yes, that is a thing. You can prevent yourself from getting HIV. Now, when it comes to PrEP, okay, there's a couple of different ways that it can be done. So PrEP, initially it was by pill, and you would take the pill every day in an attempt to prevent yourself from contracting HIV if you were in a high-risk situation. Now, I don't believe in high risk or low risk. I think that anybody having sex with any other individual is at risk. I don't care if you're married. I don't care if you've been married 30 years. I really don't care. If you're having sex with another individual because you can't control what other people do, if you're having sex with another individual, you are at risk, okay? Who said, I need to open up my own practice? Baby, I've had my own practice for 13 years now. Boop, boop. Come see me, sis. You are at risk. So now when it comes to pre-exposure prophylaxis or PrEP, we also have an injection. 2 injections are out. One is rather new. Don't really know a whole lot about it just yet. But one injection is every 2 months. And the other injection is once every 6 months. Okay. And the one at once every 6 months is rather new, right? So the effectiveness for the pill, and obviously the effectiveness is a little lower for the pill because we have to put in human error, like if you forget to take the pill or whatever the case may be, but it's still really high. It's probably about like 96-97% says that if you are taking this pill once a day, you will not, and we usually check your HIV status every 90 days. So if you're taking this pill once a day, it says that you will not contract HIV, and it's a 96, 97, maybe a little bit higher than that. I think it's like 98% chance that you will not. If you are on the shot, it's up to like 99.3% that you will not contract HIV. Now, yes, there's that. Let's talk about PEP, and then I want to get into the social stuff. Let's talk about PEP. PEP is post-exposure prophylaxis. There's so many different ways to do PEP. right? And post exposure, it can be after an assault. It can be after you do a bust down with somebody and you're like, oh my God, I didn't expect that. After a condom breaks, after unprotected sex, after drunk sex, whatever, after you got flued out. Now, there's so many different ways to do PEP. PEP is one of those, okay, it happened, whatever happened. Get to a provider. I always say 48 hours because I want to get you as soon as possible, but you have up to 72 hours to get to a provider. The sooner you get to a provider, the better. And I'm going to explain why. The sooner you get to a provider, the better it is for you and the better the chances of preventing HIV are. Okay. And the reason is because after 72 hours of exposure, let's say you have sex with somebody who's HIV positive. That person ejaculated inside or whatever, or you were exposed to the semen some kind of way. It does not start to make copies in your body for 72 hours. If you can catch it, and the earlier you catch it, the more likely it is to prevent it. If you can catch it before it starts making copies, then you can potentially prevent it from making copies, which means you can prevent it from you prevent yourself from becoming HIV positive. Does that make sense? Now, you can get it like within 72 hours, or there's like I think it's like a 422 or 421. Anyway, I don't want to necessarily quote because I hate doing these particular things, but let's say somebody all of a sudden says, hey, I'm coming into town, blah, 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 blah. You can take like 4 pills at one time, 24 hours, take 2, I think it's the 422. Anyway, you take 2 24 hours after that, and then another 1 or 2 24 hours after that, and you still have the same protection. So why it wouldn't be a thing for any person, I have no idea. Now, I want to get the myths away. I want to get the myths up out of there, okay? Because what they'll say is, oh, it introduces HIV into your body. First of all, that's a vaccine, which we don't have for HIV. It's a vaccine that introduces the actual thing into your body, sis. This medication does not. What it does is, like I said a minute ago, this medication prevents HIV from making copies. It's what we call a reverse transcriptase inhibitor, meaning it inhibits the DNA from transcribing or rewriting itself. That's literally what it is. So please don't be afraid in thinking that taking this medication is going to put HIV inside your body. It does not. Don't allow anybody to make you feel that way. Now, people are like, well, I'm afraid of the side effects. Well, I'm afraid of what will happen if I don't take it, right? So I'm saying not me in particular, I'm just saying in general. So I'm afraid of the side effects. Well, okay, well, I don't want to be nauseous, right? Because that's one of the side effects, and that's potentially, and that was back in the day. Because I'm going to tell you, doctors have been doing it for a long, long time. And the side effects are minimal. Very few people suffer the side effects, and if you do, it's probably like the first week or so that you're actually taking the medication. This is not anything new. Doctors have been doing it for a long time. If we get stuck with a needle in surgery, we get cut in surgery, we get exposed to your body fluids, we go right down to the emergency room, we go to employee health, and they give us 30 days of HIV prevention medications. It has always been any doctor who has trained. I don't know about the ones trained now. They don't really even touch people. But back in the day, all of us had done PrEP for a period because all of us have been exposed. I will never forget, it was the worst 30 days of my life because after you take the medication for 30 days, then you then go on and repeat your HIV testing at 6 weeks after the incident. And I was a medical student, actually. And I was in the operating room, and I got stuck with a needle that, that you'd be so excited they let you close the skin. And I was closing the skin. Thank God this was a small needle. The patient had Hep B, Hep C, and HIV. And my ass got stuck with a needle. Anyway, so after my 30 days of PrEP, and then it was like another 2 weeks after that, and I retook my test. And baby, it seemed like I was so scared I wanted to take a test every week for like a year. Because again, this was way back in the early 90s when HIV was still very much a thing and we still very much did not have control over it. So to be diagnosed with HIV in 1998 or 99, that was a big deal. But I was fine, praise God, and all things. But so yeah, now as far as the medication is concerned and how it works, we talked about that. Here's my issue with the drug companies that I think, and I've had this conversation, and apparently the people I was talking to was too far down on the totem pole, but I feel that they're not marketed toward black women. If you see these commercials, first of all, I don't like the fact that they come on in the middle of the night. As to say, the more risque stuff comes on in the middle of the night, right? So why are we making it in the middle of the night? And then why, and shout out to our LGBTQI family, but this is not the only people who that it affects. It's just not. So why are the commercials directed that way? Why can't I get my soccer mom, my black soccer mom, dropping these kids off at soccer practice? Why can't I get one of my Deltas, AKAs, or Sigma Gamma Rhos up there stepping, who's saying, hey, listen, I'm on the prevention, because why not? It's the smart thing to do. Like, you don't see any of that demographic. You don't see a husband and her wife. I mean, a wife and her husband, or a wife and her wife, whatever. I don't care. You don't see that. They paint a narrative, and so therefore it makes the demographic that's most at risk. And yes, black women were most at risk in the space that we're 12% of the population. We're 70% of the new HIV cases. Make the math make sense, because none of y'all think it's y'all man. It's somebody, man. So it is what it is. Again, we don't judge, we just listen. But the thing is that I feel like, and I tell my patients all the time, listen, I got your back. Let me prevent what I can prevent. Let me prevent the two things I can't change. I can't change pregnancy, and I can't change HIV. Anything else I can fix, sis. So let us deal with those two things and then rock out, enjoy yourself, have a healthy sex life, do whatever you're gonna do, sis. So that is a big deal for me, and I try and encourage black women because they don't get the information. They don't have the full story about it. Nobody talks to us about it, but you can't control it unless you fix it with us. So yes, I am all for it. I discuss it with my patients. There's not one of my patients who does not know about it, or we have not had a discussion about it. I don't shame anybody. You don't want to do it, you don't have to do it. You don't want to do it, you don't have to do it, but you will never say you didn't know about it if you're a part of my practice. And I'm talking, I have celebrity patients, I have, football players' wives, and basketball players' girlfriends, and rappers' girlfriends, and all of those people. And at the end of the day, and your regular stay-at-home wife, and executives' wives. And then these regular boys with no jobs is just out here hoeing. All of them. I have it all. I run the gamut. And the reality is these women just want to be protected. They're like, I know what he does, or either I'm not sure about what he's doing, or what can I do to protect me? I got children to think about. So, at the end of the day, it's not for a particular person. Don't feel like you're not at risk. Oh, I'm not a hoe. Oh, I'm not doing that. Oh, I'm not outside like that. It only takes one time with one person. Like, so please don't think that it takes a particular type of person, or it's a particular kind of people who do PrEP. Because that makes you the biggest setup, especially women my age who we're post divorce, or now the kids are in college. I'm an empty nester. I ain't got to worry about, I don't really have a period anymore because I'm peri or menopausal. I ain't really got to worry about a pregnancy. So I'm about to be in these streets wilding out and busting down. Woohoo! We're the highest age group for contracting that thing. So be careful how you judge, and be careful what you say. But like I said, the information is out there, and if your doctor doesn't know, be like, I need some PrEP. So yes, I agree with it wholeheartedly. All right. So what are your thoughts about partial hysterectomy, and when the patient still has their ovaries? Will the patient have to take hormones years down the line? Will the ovaries shrink over a time? Okay, that's an interesting question. We'll get back to that. Let me see. By following, unfortunately, Uh, all right, so let me see. I'm trying to make sure I get all y'all questions, y'all. Um, what are the things you recommend to be done and tested during the yearly PAP? That's a good question too. With melon spray. Okay, well, good for you, sis. All right, so what are some of the best vitamins for women over? Okay, so let's hit a couple of things. I don't know what the question is. Somebody said only HIV, not STDs or STIs. No, 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 no. We're talking about prep for HIV prevention. That's what we were talking about. We didn't get into the whole STD thing. Okay, so when it comes to your pap smear, let me be very clear. A pap smear is a screening test. People always come and say, I'm checking to see if I got cancer. A pap smear is not going to tell you that. So a pap smear is a screen, okay? It just says it screens for abnormalities of your cervix. It screens to say, hey, this person needs to have the actual test. The pap is the screen, the colposcopy is the test. Now, when you come for your annual exam, because people get this very confused, because you got these doctors who are like, come every 3 years, 5 years, 7 years. I don't know what the hell they be talking about, baby. Annual is annual. We checking every year. We're checking yearly, sis. Go somewhere else. Get somebody else to do it if you want to be on a 3 or 5 year plan. Because within that time, you can literally go from being normal to having cancer in that time. So I'm very uncomfortable with the 3 year, 5 year. They're like, it's a recommendation from whom? Would that recommendation be from the insurance companies? And I don't care what anybody says. Medicine follow politics. You can get somebody at the AMA, whoever, the American College, whatever, the right, whatever. I don't care. Annual. Period. Now, when you come, because even if, let's say you one of them people who may have had a hysterectomy, the hysterectomy may have been for fibroids, you may have had a hysterectomy 10 years ago, you may not need a cancer screen every year, right? But an annual is still supposed to be every year. You're still supposed to come in, get your breast exams, get the paperwork for your mammograms, have a GYN exam, meaning we need to look around. You got any bumps or bruises we need to be concerned about? You got anything brewing up there that don't look normal? Like, what is happening with the hair distribution there? Do you have any infections? What is hepatine? For my girls who enjoy a good anal sex romp, pump, pump, pump. I ask, so what's going on? We backdooring? What we doing these days? What's up? Because I do anal paps. Because yes, you can have HPV. And anal cancer can extend from HPV as well. So I'll be like, let me know if I need to do an anal pap now, because it ain't no judgment. It's an extra little swab, and we good. So it depends on your sexual habits, whether that's something that you feel like you need. And I like literally, I'm about to go bananas because one of my patients done put something down in the comments, and I just want to reach through the phone and grab her because you know we don't do supplements at Atlanta Premiere. But anyway, so anyway, it's a screening. So what it does is it checks to see if you, first of all, if you have HPV, and you can have HPV and not have abnormalities of your cervix, which, okay, then you don't need some types of HPV. If you got the real high risk types of HPV and you have a pap smear and we see it, then you got to go for the test because it gets crunk. But if you just have one of the random types of HPV, because there are 9 types that we consider super kind of like high risk, and 3 of those types we look for. If we see any of those 3 out of the 9, you get the biopsy regardless. You get the biopsy, sis. Off to the next room. But you can have HPV, one of the milder random types, and have a normal pap smear and see you next year. Nothing really to do. So always make sure you're getting checked for HPV. Always make sure, obviously, you're getting your pap smears. And if you are somebody who participates in anal sex, do not have a problem being like, I'm going to need my anal pap as well. Have that be, I usually withdraw my patients. Now, get a piece of paper. Get a piece of paper. Because I'm going to tell you what I check for in my practice. Get a piece of paper. All right, y'all ready? All right, I'll hold on for a minute, sis. Let me sip. I ain't sip my little Sprite in a minute. Let me sip my Sprite while y'all get some paper. Okay. I check a blood count what is also known as the CBC. I check your vitamin D. If you are overweight, I check your hemoglobin A1C. And that lets me know whether you're pre-diabetic, becoming pre-diabetic, or already diabetic. It lets me know where we at with this thing. Because y'all know I do weight management. So I check those three. Then when it comes to STD testing, I check hepatitis B, hepatitis C, HIV, syphilis, as well as herpes number two. I don't check number one, okay? Because 99.99999% of the people gonna have herpes number one. That's fever, blister, that's cold sore. Child, you probably got it in daycare. I ain't got time. But I do check herpes 2, which is AKA genital herpes, okay? Which a lot of practices do not check, even though you say check me for everything. A lot of times they do not. And you think you're being tested for everything, and you are not. So make sure you specifically say, can you please check me for make sure herpes 2, HSV 2. So that's what I check for. On top of the pap itself is generally, I don't know, some of these doctors don't be checking the paperwork, but it's supposed to check gonorrhea, chlamydia, and trichomonas. It will check as well. Okay. I also, because y'all know who y'all talking to, I also do a full vaginitis panel, a full cervicitis panel, and a full yeast panel. I just do. That's your yearly with Dr. Tosh. Anything, now I usually will tell people, and I'm usually right, anything that's not sexually transmitted, I can usually pick it up at your visit, and I usually treat you for it at your visit. And that's usually how I get down, whether it's a cervical infection, a vaginal infection, yeast infection, whatever. And then every patient, every patient in my practice is on vitamin D2, 50,000 units, once a week. Okay. And so that's very important, very important to me. So that's what you should be getting checked for. Also, somebody said something about a partial hysterectomy and some ovaries and Let me just get y'all clear on something. When it comes to hysterectomies, the only thing your uterus is responsible for is bleeding and carrying a baby. Boop, boop. Your ovaries control your menstrual cycle. They control the whole menopause thing. Those are your ovaries, right? So they left your ovaries. Obviously, you had a hysterectomy and you were reasonably young enough that they left your ovaries, which was a smart thing to do. And so you'll know, obviously you don't bleed anymore, but you'll know whether you are menopausal, one, or perimenopausal, or menopausal by one, your symptoms, and by the blood work. You have to do blood work on hormones that'll let you know whether you're menopausal or not. Now, whether you take hormone replacement is totally up to you. You know, I do bioidentical hormone replacement, which is all natural hormone replacement. I do it myself as a patient, and I do it at my practice. I love it. It is actually, it enhances your health. It enhances everything about you. I don't like synthetic hormone replacement, which is the pills, the patches, the creams. I ain't the one. I don't like them. They're poorly regulated in the space of how you take them, and it's just so generic to me. I don't like it. Anything synthetic is going to be cancer causing. So I'm not in a space of doing more harm than good. So I don't do that type of hormone replacement. But I do the bioidentical. But whether you do hormone replacement is a personal choice. And so because you have ovaries doesn't mean you need hormone replacement. That's not how that works. It is a personal choice. When you go through menopause, yes, you have to deal with, cardiac issues, your cholesterol getting higher. You know, a lot of times people have the whole midsection, increases in size, bone thinning. So there are medical issues attached to menopause as well. Not just vanity issues, but there are medical issues attached. But whether you do it or not is solely up to you. I have patients who are like, I don't want to do it. Not a problem. Makes perfect sense to me. Hey. But there are some patients like, give me what you got, because I'm not about to live like this. I understand. I feel you. So don't think because you still have ovaries, because that's the gist I got from the question. Maybe I was wrong. But because you still have ovaries, you have to do hormone replacement. That's not how that works. Okay? All right. I'm not even dealing with you with this azo foolishness. I'm just going to keep it moving. But boop, 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 boop. That's how that was. Absolutely. I worked at the Western Representative, and it was always targeted toward the MSM population. Infuriating. Right. That's what I'm saying. They don't put things in front of us sometimes. And sometimes if you put one bad word, and sometimes I don't know, I'll be thinking to myself, is this purposeful? Because sometimes you can seed negative information about something that's really good. In our community, we so scared going back to Tuskegee and all the janky stuff that's done. Any little one word of something that sounds like it's a setup, we like, yes, sis, I'm doing a whole perimenopause. We're going to get into it, honey. And I really want to do it. I want to go live with it, living room style, once a week, probably for about 3 or 4 weeks in 2024. And I'll probably do it the month of February. 2025. So, and I'll probably do it the month of February. So stand by for that because it's going to be a key, honey. Yes, 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 pap smears. Now, when it comes to, let me say this, y'all. Let me say this. When it comes to vitamin, if you're taking D3, don't let me bastardize D3. I'd rather you take D3 than take nothing. But we do know that when it comes to taking something every day, your compliance is going to be less, right? Because you're going to miss a day. You're going to miss a day here and there. You're taking 2,000 milligrams here, 2,000 milligrams here. Obviously, your body is not your body is not absorbing the whole 2,000, and then you're missing some days. So like I said, I prescribe the vitamin D2 is by prescription, guys. It's not a particular brand. It is by prescription. It is 50,000 units once a week. It is by prescription. I don't know what damn brand it is. It's whichever one pharmacy gonna give you. But it is by prescription. That is the one that I prefer. Now, somebody asked about estrogen. Very interesting. I do know of estrogen. I've seen estrogen. I've read the ingredients in estrogen, which I told you guys my undergrad degree is in chemistry. So sometimes I think that I just put the extra spin on there. But estrogen, do I feel like it's dangerous? I don't feel like it's dangerous completely. And what does that mean? Like, I ain't got no problems with estrogen, but understand that estrogen is based in soy. And understand that when there's soy and there's a lot of soy present, soy, one of the byproducts of soy is phytoestrogens. And phytoestrogen is going to increase that estrogen level, and it potentially has a risk of increasing cancer. So it's not that anything is wrong with it. If you take it and you feel like, oh, this knocks out my hot flashes, great. There's something that is called Veoza. And Veoza is a new drug that's out. It is non-hormonal. It is completely non-hormonal, completely. And it knocks out hot flashes. Now, it ain't gonna work in a minute. It's medicine, not magic. It's gonna take a minute to work, but the only thing it is going to knock out are your hot flashes. So if you're somebody like, nope, that's all the symptom I got, I don't have anything else, then maybe you should talk to your doctor about getting on Veoza. It's Veozah. Read about it yourself, but it is non-hormonal, and it only knocks out hot flashes, okay? But like I said, over-the-counter, I'm very funny with over-the-counter handling medical problems. And why do I say that? What I usually break down to my patients is this, and I love it. We'll talk about that, the hysterectomy and sex. Yes. I love it when I break this down to my patients and they like, damn, I never thought about it like this. I say, whatever is happening with your vagina, if you're having a problem with your vagina, y'all listening to me? Can you hear me? Do I need to pull up a little closer, sis? If you are having a problem with your vagina, there is nothing over the counter that is going to help you. I said it and I mean it. Think about this. If you have an infection in your tooth, your mouth is abscessed out to here, it's pussing, your breath stank. Is there anything on the aisle at any of these stores that will fix you? Is there anything? Nope. If you have an infection in your C-section scar and it's oozing stuff and it smells bad, is there anything on the aisle at any of these stores, grocery stores, convenience stores, any of these stores? Is there anything that's going to fix you? No. So, can you help me understand why, if you have an infection in your vagina and this feels smell bad and this ooze and stuff, why y'all think it's something at the store in the aisle that's gonna help you? Don't do that. You're wasting your money and you're potentially making the problem worse. Don't do that. Okay? Now, one of the things that somebody just asked me was if I have whatever, do you have to? No, if you have herpes, you do not have to let your dentist know. You don't ever have to let anybody know, to be perfectly honest. Herpes is a contact thing, it is by contact. So your dentist shouldn't be all up in your mouth without gloves anyway, and even if they did, it's by contact. So no, you don't need to let them know that, or anybody else for that fact. Boop. And I did a whole podcast on herpes. It's like an hour long. Y'all don't ask me nothing about herpes. When y'all get done with this live, y'all click a couple of videos back and watch the whole thing on herpes. Okay? All right, cool beans. Now let's see what else we have. Oh, somebody asked me about hysterectomy and sex, because I got about 11 minutes and then I'm gonna dip off. Hysterectomy and sex. It does not fit. Well, okay, so everybody's different and it depends on the type of hysterectomy, but theoretically it should not be any different. What does that mean? Some people have a hysterectomy and their cervix is left in place. Okay, because back in the day, here's the myth. Back in the day, it used to be leave my cervix because I don't want sex to feel any different. Because some reason I think they thought the G spot was in the cervix, right? So a lot of women got, wanted the hysterectomy but left their cervix, blah, 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 blah. So through the chitlin circuit, I guess somehow it got circulated um that I guess somehow it got circulated that, oh, if you have a hysterectomy, you're not going to derive pleasure from sex. Child, lies. It should theoretically feel the same. You shouldn't feel any different. So yeah, no, you should be good, sis. You should be good. And I'm having regular periods affecting my eyesight. Child, how heavy is these periods? Is they affecting your eyesight, sis? Um, no, never heard of that one before. I mean, I'm having regular and it's affecting my eyesight. Now, I mean, the only thing that I'm like, is your pressure dropping so much from this bleeding that you're seeing little floaters? Like, cause girl, you got me with this one. But it goes back to normal. Is this now? Again, the human body is a very interesting thing, right? And could you be having what we call a vasovagal response? You could be. Sometimes when your body is in so much pain or something's happening that's so off, sometimes your body will respond in different ways. Sometimes your pressure drops. Sometimes people get nauseous and they vomit. Sometimes people sweat. Now, I haven't necessarily heard the one about the eyesight, but that doesn't mean that's not one of what we call the responses to your periods. Because if they're that heavy, then it may also be very painful, and it just may be maybe your body's response too. But I would be, as a gynecologist, I'd be like, I don't know that this is in my will well, but what I would be a little bit worried about was, is there something neurological happening? Like, because this happens to this, happens to this, and this hormone goes up, and progesterone goes up, and then the spasms, the musculature in your blood vessels spasm. And do we have musculature in the blood vessels to the heart? I mean, to the eyes that are spasming and causing. So that would be something I would definitely talk to my primary care about, and I would be like, hey, can we get some imaging of my head done just to make sure we don't have any neurovascular stuff going on? So, I would definitely, especially if your vision is, I see you saying no floaters, but it's blurry. I would definitely be a little bit concerned with the change in hormone levels. Maybe that has an issue with the blood vessels in your head. And I probably would ask for an MRI, MRA, MRV, and ask to see a specialist just to make sure that nothing was going on. Weird stuff can happen. The brain is a very interesting thing, and it's just like, where the hell did that come from? And it may be an aneurysm or something that they can kind of clip. I don't know. I don't want to scare you to death because I have no damn idea what it might be. I don't know. But I would definitely tell my primary and say, hey, listen, I think I need, they call it like MRI MRA of the arteries, and MRV of the veins. So it's MRI, MRA, MRV, just to get some imaging done of your head to make sure nothing is being missed. Okay, I'm just super anal like that. It could just be nothing. It could just be your body's response, but just to be sure, sis. Okay. All right. Idea 44 never had bleeding until now. Is this perimenopause or the IUD or both? Could be both. Could be both. And to be perfectly honest, I love a good IUD. I love a good IUD. If it's and you never had any issues before 44, is that prime age to have that perimenopausal bleeding. But I would say start with an ultrasound. Start with an ultrasound to make sure your IUD is placed properly. And then get some check stuff done, some vaginal stuff done, because sometimes if you have an infection in your cervix, or you have a chronic infection, or just an infection, it just generally, it can cause bleeding. Okay, so between checking an ultrasound to make sure your IUD is placed properly and checking for infection, you should pretty much, be able to get some answers from there. Okay. Okay, so here's the thing. Any suggestions about anemia associated with heavy bleeding? And I always love this question because it's like, hey, doc, can you give me a solution without fixing the problem? And then especially we can't tolerate iron supplements. That's fine. Don't have anything, okay. Do I think beef is going to significantly help you? The question, sis, is why are you bleeding heavy? Why are you bleeding heavy? Let's fix the problem. So if you're just a heavy bleeder, what can we do about that? There are procedures that we can do that are non-invasive. There are different things we can do that are non-invasive that can help with the heavy bleeding. If we have fibroids, let's get into that. But I'm always just like to the patient, so you want me to keep giving you solutions, but you don't want to fix it? We can fix it. You don't want to fix it, sis? So I would say, sis, my suggestion would be, let's get to the root of the heavy bleeding and fix that. And then your blood count won't actually come up because you won't be bleeding anymore. So, girl, low vitamin D contributes to everything, honey. Everything. If the pimple on your nose, everything. Hyperpigmentation, everything. I'm like the vitamin D police. Baby, I am like the police, okay? District attorney out here. So painful periods. All right, so guys, I got about a few minutes. Where was y'all with all these topics beforehand? But anyway, I have a few minutes. I just want to, as we close out 2024, I just want to thank you guys. I want to thank you guys for being open to receive what it is that I'm trying to give. I don't know. I'm so grateful. My heart is so like full. Because it seems so corny, right? You say, I just want to help people. Like, it seems so cornflake corny, but it's really true. And it's not that I'm excluding any other race, because I'm not. It's like people just don't understand. You can love a thing without hating another thing. And we as Black women, we need the help. We need the support. And I think what burns my ass more than anything is when you have women out here, you have doctors out here who look like us, but they're not operating in our best interest. And that makes me so angry. And by the time you get to me, somebody who you can trust, you have met so many people that you don't trust. You don't trust me either. And now I got to fight that uphill battle. So I just appreciate you guys for hearing me, for truly receiving what it is I'm trying to give you. One patient, somebody, I don't know whether she's a patient, I can't say she's a patient, but she jumped into my DMs and was like, well, this doctor is saying this and you're saying that. Who should I believe? See, that's nonsense. My attitude is I come on to educate. I don't come on to convince. I come on to educate, and then you do with that what you decide to do with that. And I hope all of you are in that place. This year in 2025, I'm going to share some of my stuff. I am personally making a conscious effort to care for my spirit more, to care for my mental health more. When I'm tired, say that. I am never in I don't even know, since I started my own practice, never just willingly, unless something was going on, just took a day off and said, I'm not coming in today. I know I got patients on a schedule, because I'm always like, if I got to push through and I got to do what I got to do, I'm going to do what I got to do, because these people took off for work. They did this, they did this. But some days I don't have anything to give. And I need to be more cognizant of that when I'm getting to that place, being more spiritually in tune with, positive affirmations for you guys and for me as well. I would like to normalize a couple of things. I would like to normalize exercise in my life. I would like to normalize spiritual growth in my life. And I would like all of us as Black women, and you see my neck got real, to normalize speaking at a conversational tone in a restaurant. And it's always the ones. You don't have to laugh that loud, sis. You don't have to talk that loud. Have some grace. Have some decorum. I want us as Black women. Oh, and if you guys didn't see a movie, go onto Netflix and see 6888, that Tyler Perry joint. It's going to make you mad at first, but just be patient with it and get the overall whatever of the story. I want Black women to go back to that, to the decorum, to the, just the pride, the just all the things. And I'm starting with me. I'm starting with, just giving grace and being neat and being a 10 every time I'm seen, and being a 10 with everything I'm doing. And I challenge all of us to that excellence. And you ain't got to wait till 2025. You ain't got to wait till 2025. Do it today. Start today. So I am praying that you guys got something good out of this. We're going to do this again. I'll be bobbing and weaving back and forth between Instagram and YouTube. I'm trying to pick up all the girlies and give out all the knowledge. And remember, y'all be looking for this survival manual. It's a surviving the hospital, surviving labor and delivery, surviving your hospital stay. Be looking for the manual. It'll be on site. It'll be on sale on my ex Dr. Tosha page. I don't know. I'm gonna have my team put it somewhere. Y'all don't know where it's at. Y'all don't know where it's at. And I'll probably even have like a discussion about the things that are in it. Once we get it out there, I'll pull a couple of people and maybe we'll have a little, a little shindig, a little get together to discuss what's actually in the manual. But I'm looking forward to getting this information out to you guys. And if you're a healthcare provider and you're a labor and delivery nurse, or you're one of the younger obstetrician gynecologists, and you want the information, girl, have at it. I'll come and teach it. I'll come and talk about it. I'll come and do baby, as long as we're saving ourselves and saving these babies, that's all that's important to me. So I hope you guys got something out of this. I want to wish you guys an amazing 2025. God wills we all see it. And we'll close out 2024 on a beautiful, a positive note. And I am so grateful that you guys allow me into your home, into your hearts, into your minds, and, just give what it is I have to give. So I love y'all. Thank y'all. And what y'all gonna see next year it's gonna be lit. And I'm so happy for it. So you guys have an amazing holiday. And then I'll see y'all on the other side of thing if God wills it. Okay? All right, y'all. Bye.